Right. So I'm with Dr. Anri Bici, our new chiropractic doctor here at Tri Health, and we're going to talk about your specific offerings, your market, your style of practice, because I feel like you are complementing what we offer here. You have a very I feel like a very unique style, and I mean, because I'm sort of a gadgets guy. So if you, I mean, you the people can't see, but it looks like a studio here. And then in terms of practice, I like using a lot of different modalities. So why don't you share your experiences in terms of like, what you like to offer and why, and your style of practice?
Hi, everyone. Thank you, Jason. Yeah, I've been practicing for 5 years now. I'm a chiropractor. And I like to specialize in specific conditions and use certain modalities to help alleviate pain for patients. So be it chiropractic manipulation or adjustments. So that usually helps if you have any spinal issues or joint mechanical issues. And then we further dig into it by seeing if there's any muscular issue. And eventually we use some sort of modalities, like be it laser, shockwave, or electrical therapy, proven modalities that can help alleviate pain. So with shockwave therapy, for example, we focus a lot on trying to break away the scar tissue. So if you have like conditions for the elbow, like tennis elbow or golfer's elbow, any issues with the shoulder, any issues with the feet, like plantar fasciitis, even with knee conditions, it can help a lot. So it can increase blood flow to the area, and this can really alleviate the pain symptoms.
So I want to ask about shockwave because I mean, there's other modalities that or they claim to do similar things, like bringing circulation and breaking up scar tissue. What is special about the shockwave machine? Is it like the intensity, how it can localize, how is it even how is it transmitting that?
So it does use acoustic waves. So it's a little bit similar to ultrasound,
right?
But it's very strong. So it's able to go and penetrate deep. So therefore, by having a stronger force, it can break away adhesions.
Okay.
So that's kind of a difference in that regard.
Yeah. What does the patient feel?
So it is a quick thrust or a quick hit continuously. So you need to make sure that we manage with patients' pain tolerance, because obviously if you go too high, it can get very painful. Like originally, Shockwave was actually introduced into the market to break up kidney stones. So over the years, they've developed into using it towards musculoskeletal care.
So like, would you say like it's relatively comfortable? Like, I mean, someone can have a therapy, like a session, and it's not like they don't regret it. They feel better afterwards. They won't regret it.
Like it has over 90% success rate.
Okay.
Usually you can get that achieved within 3 visits.
Oh wow.
So sometimes.
Yeah, and how long is a visit, like on average?
So like once a week, you do it for like 3 weeks, and it can alleviate most of the pain. Sometimes patients feel a relief within the first visit or a big difference.
Yeah.
Okay, so
it's almost like, I mean, the analogy is like you get like a deep tissue massage. Like it's a little bit uncomfortable, but then afterwards you get off the table and it's like, oh my gosh, I can move now.
Exactly.
Okay, that's really cool. I've seen the machine in action and I think it's amazing. What other modalities are you offering?
So the other modality I wanted to talk about was laser therapy. So laser therapy has been on the market for years. And the way that laser works is it's pretty much, I always try to explain it to patients, if you think of like the sun, it provides energy for the plants. So it's the same thing for our tissues. It's using energy in order to enhance the speed of healing of the tissues that are injured, right to the cellular level. So this can, obviously, it increases blood flow, like we said before with Shockwave, and you were mentioning different modalities that do that. But it's good for acute injuries or any injuries where the muscle is strained. You can really enhance the speed of recovery with laser. So obviously under the right parameters, because you don't want to cause other alternative outcomes.
Okay. So when someone needs laser, like, is it that you're assessing them? Like, is it like, I guess, how do you decide? Like, is it like the nature of the injury? How acute is it? How fast or slow the healing process is?
Yeah, so you can take into account the patient's age. A lot of patients that have arthritis, laser helps very well with arthritic conditions. Also, like I said, if it's an acute injury, it can help. sometimes even with chronic injuries,
Yeah.
where it might be that the muscle might be a little bit weak or the joint is not functioning well. So you want to remove any pain or any swelling in the joint, and then hence you can do rehab after to fix that issue. So chronic, acute, and for most patients, arthritis.
Yeah. So I mean, this sounds like these are all like people that are having pain, and the treatment itself is like you don't really feel it.
Oh no, laser, it's a very good treatment. You might feel a little bit of heat, so if anything, it will relax you.
Yeah, the warmth. I mean, I'm just contrasting with like Shockwave. So someone who has like acute pain or arthritis, the Shockwave isn't an appropriate treatment.
No, it might cause them a lot of pain. Usually with plantar fasciitis, like as we were mentioning, which is a foot condition, it can cause a little bit of pain as you're using Shockwave. So you have to tread carefully with Shockwave in that sense. Whereas with laser, over 95% of it, you're comfortable as you're getting the treatment.
And like, so what's the rate of recovery? Like how fast? I guess it depends on how long they've had it and the severity, but do people notice improvement like the next day, within a couple weeks?
Usually there is clients, but on the evidence that I've read out there, it's usually 5 to 8 visits with a laser can give you some good results or a good drastic change in your pain symptoms. So Shockwave sometimes can be faster, but obviously you need to use it for the right condition. We cannot use some like Shockwave on a swollen ankle, for example, right?
Right.
So that's just going to cause more harm to the patient. So
okay.
But both of these devices have great success rates. Yes, laser sometimes may take longer, but you're dealing with a little bit of a deeper condition, so you can use laser for any arthritis in the low back, in the neck, so areas where you can penetrate deep through multiple layers of muscle.
Okay. What would, like, is there anything that the person can do at the same time or concurrently? Like, say they're doing laser therapy, would you make any other recommendations on top of that?
Yeah, so based on the assessment findings, based on the history, if the condition is acute or chronic, we might recommend like rehabilitation. We might recommend adjustment therapy in the form of chiropractic, muscular therapy in the form of soft tissue therapy. So certain muscles need to be active, the joints need to be moving. And on top of that, you can use these modalities to enhance recovery much faster.
Okay. So it's not like you're just using one treatment or one style. It's sort of like it's like it might be the main tool, but you're doing like a complementary treatment protocol. And I think that's something we discussed before. It's having more of an integrated approach, whether it's other practitioners or various styles of treatment in the session, that you're kind of complementing each other in order to kind of advance and speed up the recovery and you know, get results faster.
Exactly it. So we want to make sure that for every patient, the treatment might change a little bit here and there depending on what they need, but we have multiple tools in order to achieve our success or our results.
Is there like a group of patients that you tend to see? Is it like athletes? Is it maybe elderly? Is it people that just have chronic pain? Like, I mean, I'd imagine like they're all people that you're helping.
Yeah, it's just all over. So mostly I would say they range between 25 to 55 or 65. Sometimes I do see children, but most of the time is between those ages.
Right. And I think there was another modality that you had mentioned, the electrical.
Yes, the electrical therapy modality. So that's very good to usually help with like knee injuries or ankle injuries, anything where you have a lot of swelling. It helps to flush out the inflammation. It helps to relax the muscles. So if you're having a lot of muscle spasm, in that regards, it will help a lot. Also, I do tend to use for patients who have had atrophy or weakness in the muscles due to chronic injuries that have never fully healed. Right. Maybe the pain symptoms went away, but they just feel like the joints are just not working well. So you can use Russian stimulation. So that enhances a lot in the recovery of the muscle strength.
Right. So I mean, I like the your style of assessment. I think is interesting because you use the science of the therapy to kind of outline how many sessions that person's going to need, because it's not like, well, maybe 6 or maybe 10. Like you kind of have like, you know, this has already been studied, this nature of injury based on the severity, your age, all these factors. You're going to see, you're going to have, some improvement after 4. You're going to have, a noticeable improvement after 6, 8, whatever it is. So I guess, do you find that that actually encourages the patient to understand the process? Because a lot of people be like, yeah, I'm going to see so and so. I don't know, I'm not sure why I'm going. I go so many times. Like, can you speak to like the science behind the treatment protocol?
Yeah, absolutely. So based on every treatment plan that I provide, I'm trying to hit targets. So I want the patient for every visit to get better. Sometimes you might have patient in the first couple of visits, they're just not getting the results, and after it kicks in, sometimes patients right away feel a difference. So usually with patients that feel a difference right away, it's an easier path. We're going to achieve the goal much faster, much quicker. But yes, we're going to base it on the condition. We're going to base it on the type of treatment that they require, and also on the chronic condition of the patient. For some patients, we might hit a roadblock, so then we got to revisit. Is there something that we missed? Sometimes, like, I have to x-ray patients. For example, if we're talking about arthritis, I might have recommended to the client, X amount of visits is really going to help. But instead of achieving 80 to 90% recovery, maybe we've achieved 60. So it could be due to the fact that there is higher levels of arthritis in whatever joint we're dealing with for the patient. So in that sense, they have an understanding that, okay, we're actually doing great, we're improving. It's just that due to the fact that we have other underlying conditions, it's going to require a little bit more time. So then we try to expand where I have a short-term phase of care and a long-term phase of care. So then the patient understands, obviously in the beginning, we need to get rid of pain so they can go about their lives. But then there are some conditions that might take longer than others. They need to understand what my vision is to match their vision, so then they have the patience to finish the plan.
Yeah. I think that the compliance, I think, greatly increases when they realize that, you're assessing things along the way. There's checkpoints that you're looking for. And
even on every visit,
yeah,
try to see, is the joint moving a little bit better? Do I notice the muscle function being better? If there is something that the patient has, like swelling, has the swelling diminished, and so forth.
You had mentioned something about requesting x-rays. Is that something that you provide a requisition for?
Yeah, so I can fill up a requisition, and then we just need to get the patient to go to an x-ray facility.
Okay. Because that's something a lot of people, it's been difficult to get into their family doctor and whatnot, but having access to,
absolutely, that helps a lot.
That you can, you requisition it directly, you get the results, you can discuss it with them. It cuts out all, weeks of delays and extra appointments and moving around where people are sort of limited right now. Is there any other treatments, or is there any other services that, you offer or provide right now that you want to share?
For example, we can talk about braces for certain conditions, like patients that have severe OA. Getting a knee brace can help to support through their daily living. And orthotics. A lot of people have problems with their feet, problems with their knees, so it works all the way up to the back.
Right.
So making sure that we provide them the right orthotics can really help to make it easier for them to walk and alleviate any pain symptoms all over the body.
Yeah, and a lot of people, they have coverage.
Most of them do. So in that case, we can make sure they get a doctor's prescription, and then we can do the examination, the mechanical gait analysis, which is the walking, to see how everything is functioning in the legs pretty much, and then go from there.
I want to kind of wrap up. I want you to kind of share one of your big success stories, a case that comes to mind where it's you saw someone, whether they were in really bad shape, that you can brag about how you figured out what, no one else helped this person until they met you.
I've had a few. Well, one that can come to mind right now is it was nice the patient hugged me.
Yeah.
But just severe back pain, and just over the years he just wasn't getting the right care, or he wasn't being told about the plan properly, so there was no guidance. So he kept going on and off in different chiros, different physio clinics. I just took the measurements to understand what the condition, what was happening with him, certain muscles that were not functioning right, got them to move better, got his joints to move better, and then eventually he felt great. And he was the type of guy that loved doing gardening and doing stuff around the house. So
he was able to do it
just
again.
walking in with pain like this, and then after a few sessions we were able to get him well on his feet, good to go. It was was very nice for me too. It was a very good feeling.
Yeah, it's rewarding.
Absolutely.
This was, I really enjoyed touching base and kind of reviewing some of your interests and what you offer. So we're going to put out the word, and people are going to hear about this amazing chiro. And hopefully you'll have a chance to come in and see Dr. Anri. Okay? Thanks, bud.
Again.